welcome. This is Megan Antonelli, and I'm excited to welcome another Health Impact speaker back to Digital Health Talks today. Please join me in welcoming Emily Zhen. Emily is a principal at Zeal Capital Partners, where she focuses on driving economic mobility through investments in health equity, financial inclusion, and the future of work. With a background in healthcare investing at NEA and Goldman Sachs, as well as experience as an early-stage digital health operator, Emily brings a unique perspective to venture capital. As the daughter of Chinese immigrants, she's passionate about empowering underserved communities and backing diverse founders. Today, we'll explore Emily's insights on the evolving landscape of digital health investments and the critical role of diversity in shaping the future of healthcare innovation. Hi, Emily. How are you today?
I'm doing great. How are you, Megan? Thanks for having me.
I'm good. Thanks so much for joining me. It was so great to meet you in New York at Health Impact, but we didn't get enough of a chance to talk, but I enjoyed your panel so much. So I'm so glad you can join us today.
Likewise, it was a wonderful event that you put together, Megan, and had so much fun on the panel, and looking forward to chatting more today.
Yeah, well, it's so fun to meet investors in this space and particularly women working in this space. So I'd love to hear your story on how you got into investing and kind of what your journey has been so far, and of course, what brought you to Zeal.
Absolutely. Happy to share. So I grew up in the Chicago suburbs, and I've always been really passionate about healthcare. I've always loved the sciences and biology, grew up doing research and volunteering at the hospital. But at the same time, I was also very interested in startups and innovation. I had started a company back in high school, and wanted to continue that. And so I went to school at Penn and studied biology and business. I was pre-med and a business dual degree through Wharton, and got the chance to realize that there's actually a lot more overlap. A lot of the challenges in healthcare are not purely just scientific and medical in nature, but they're due to challenges in technology innovation, in policy, and ultimately business systems not always working together well. And as you alluded to, coming from an immigrant family, my grandparents played a huge role in raising me. And I saw their journey in growing older and also in not necessarily being fluent in English, right? And so having that role as an English translator and also caregiver gave me a personal lens to healthcare as well, which motivated me to learn more about venture capital. And so early on, I worked at several digital health startups, including Healthy, which is a digital health EMR infrastructure platform, and a company called NeuroFlow in the behavioral health space that does a lot of work in value-based care and behavioral health. And I realized that I loved working with early stage companies, but I didn't realize it was a job you could do right out of college. And so wanted to just get more experience working with healthcare companies and seeing what it would take for large healthcare companies to really scale and be successful and continue growing. And so I went to work at Goldman Sachs, as you alluded to, in healthcare investment banking, and there got to take part in IPOs and M&A while I was there. Oak Street went public, and Moderna, for example, got to work closely with a number of companies from life sciences to medical device and digital health on acquisitions across gene and cell therapy to more value-based care as well. And so had a great foundation there. Realized I still wanted to work in earlier stage and work with startups, going back to that North Star. And so I ended up joining NEA in the beginning of 2020 and moving across the country from New York City to the Bay Area. And I was at NEA for a bit over 3.5 years, had a wonderful experience there, investing multi-stage from incubation to growth investing and even in public companies across both life sciences and therapeutics and digital health and healthcare services and delivery. There I got to incubate companies and help invest in companies like Strive Health and value-based kidney care, to Curana and value-based primary care for senior living communities. So very impactful companies seeing them through from ground zero and getting to participate in later stage funding rounds as well. And then I learned about Zeal, was connected to the founder of Zeal Capital Partners through a mutual friend and actually a board member that I work with while at NEA. And so through that, I was connected to Nasir Kadri, the founder and managing partner of Zeal. Was really interested in what he was looking to build in the health equity vertical in particular. So Zeal Capital Partners is a mission-driven early stage venture capital firm that has the mission of closing the gaps in wealth, health, and skills across the US, and wanted to add healthcare as a sector, realizing the importance of health equity and economic mobility. And so the chance to really take my background experiences to be able to start that and also invest in fintech and future work and learning was super interesting. We connected for what was supposed to be a 30-minute Zoom call, and it ended up being over 2 hours. Just incredible mission alignment, the chance to be entrepreneurial, to build in an area I was very passionate about, and to start the health equity vertical, build the thesis, help lead that focus here at Zeal. And the rest is history. So I joined a little over a year ago, and since then have built out the thesis to our health equity focus and have made 8 investments overall, 3 in the healthcare space that I'm excited to share more about. And they're across access and affordability of care, women's health, mental health and wellness, and social determinants of health, which are our 4 main focus areas.
Wow, that's an amazing path to this, but almost, a story like the storybook, classic path, right? From Morton to New York, starting in Chicago, some great cities there, but also lots of great experience. And obviously, like just at the, sort of at the ground, as these digital health startups are happening. And it's funny, being in this for a while and seeing how things move slowly. When you think of the last 10 years in digital health, things have moved really fast, and we've seen a lot of change and a lot of companies come and some go as well, but such a diverse group of companies you worked with. So that's amazing what you bring to this, to this space and to the conversation. And it sounds like, Zeal, in terms of where their interest lies and their investment strategy, that you've got, a really diverse group of portfolio companies. So I'd love to hear more about both the strategy as well as, around inclusive investing and what does that mean? I think our listeners would be really interested in that.
Absolutely. So Zeal has a unique strategy that we call inclusive investing. And this is actually a market-backed approach that is also trademarked. It has 5 prongs to it, which are diverse fund managers, diverse management teams, geographic inclusivity, investment focus on our sectors, which are fintech, future of work and learning, and healthcare with a lens towards health equity, and systems change as you think about actually measuring impact. And so what that looks like is we take a holistic approach to looking at companies and really prioritizing diverse lived experiences that are relevant to whatever companies the founders are building. And so this is across geography, gender, ethnicity, age, background and experiences from a career perspective, veterans, LGBTQ. It's very broad in terms of how we look at it. And we don't look at it as anything to screen out, more so as a way to think critically about how companies can serve diverse communities and serve underserved communities, and if they have teams that reflect the populations they're serving. And we also care a lot about ensuring we are having a broad funnel when we think about sourcing. So we actually track these metrics in terms of where we're sourcing from and who we're sourcing from, and the teams that the makeups of the teams that we're investing in and the experiences that they bring. And so I think it's a unique approach to investing that that allows us to broaden our reach when we source, but also to remain focused on our core sectors that are related to closing the wealth, health, and skills gaps, which are fintech, future of work, and healthcare.
Mhm. Oh, that's really interesting. And I think, with healthcare in particular, obviously fintech and future of work also. But, when you think about sort of that, we talked to Robin at Work in Health, patients as designers and patients as founders, and kind of that, when you have the problem, when you start with the problem that you're facing and you solve for that group of people. So I think in healthcare, it is so important. And we see, particularly with women's health, often, these problems are, so rarely even addressed, let alone coming through with that lens. But tell us a little bit about some of the portfolio companies in healthcare and what some of that, diverse leadership looks like.
For sure. Well, you mentioned women's health, and we're so excited to be announcing our Series A investment in a company called Seven Starling. They are a women's mental health platform that delivers virtual, individual, and group therapy for moms from prenatal through postpartum care, and expanding into areas like menopause as well, and providing holistic mental health support for women. It is a all-female executive founding team with Tina and Sophia and Julia. And they all bring lived experiences to the table, given their own experience as women. Tina actually, the CEO, just had a baby of her own. And so it's been incredible just following along their journey and having met them back when I was at NEA and tracking them and getting to invest in them at Zeal. Well, that's just one example of a company that is very mission driven, of folks who come from immigrant backgrounds. And Tina comes from an immigrant family, but also all women who have encountered and seen some of these women's health challenges either themselves or through others. And it's an area I'm very passionate about, having friends with different women's health conditions. I'm not a mom yet, but I want to be one day. And so it's definitely an area that is top of mind for me as well.
Yeah, I do. What I find in this is, especially with women, and when we hit the space where we realize there's a problem, we want to solve it. And that's where a lot of our entrepreneurial spirit tends to kick in, right? And we realize that there is a gap. And then, that's where we have, can really bring strength to the table. And when you see all of the great businesses that are created, by women, for women, it's usually because they've been, it's a problem they've had, right? Or a gap that they see, and luckily, or not, maybe not so luckily, but there's a lot of them to tackle. But talk a little bit about, as your experience, you mentioned, I mean, just the investment community alone is not particularly diverse, right? I remember going to, I won't mention the conference, but a conference in healthcare, and feeling like, whoa, the first year it's gotten much, much better, but it was a very different feeling because in general, healthcare is a diverse field, maybe not as much as we want it to be at the C-suite levels, but throughout throughout a hospital and a health system organization, there is diversity. But then when you look at the investment room or the boardroom, there tends to not be. So as a woman coming to this area, and certainly Goldman Sachs and all of that, tell us a little bit about your experience, but then also how does that translate into the advice that you give to the female founders who are your portfolio companies?
Definitely. I would say I've been in rooms where sometimes I'm the only female, which I'm sure you have too, Megan. And that could be a boardroom, could be a meeting with C-suite executives. And one of the challenges that I faced was honestly just overcoming the fact that I looked different and had different experiences. I think that it took me some time, especially when I joined VC, to find my voice and bring my unique voice to the table. I think I've always been a bit more of a listener first, which I think is a fantastic quality that I have and many other female peers have, but to also not be afraid to share your insights and voice when they can add value to the table. And so that's something that I've encouraged my interns to really channel, and people who I work with when they're early on in their venture career to definitely listen, to soak up, to observe, but also to share their thoughts on what they think about an investment, to not be afraid to voice a dissenting opinion. Those are all skills that I learned over time and am continuing to just become more comfortable, especially in a room of people with people who look different, and people who are often very experienced as well, to be able to have the confidence and believe that I have a unique perspective to provide.
Yeah, it's so important, and I think reminding them that the difference in the observations that they make are that's why they're there, and it's what brings them to the table. I've come across a couple of times, but maybe because of my age, but more and more I'm finding more mature founders around, within healthcare, and maybe not as, in healthcare, as you get, we're faced, the sort of the sandwich generation. We're taking care of our children and our parents at the same time. Also just sort of the prevalence of chronic disease and management and how that's managed. And, as you get older, you're facing more healthcare problems. Therefore, you're getting into that space. When you look at some of those founders and are there specific words of wisdom, advice to the more mature entrepreneurs and innovators out there coming to healthcare?
Definitely. I think what's been really inspiring is seeing more female founders continue to absolutely crush it while they have new babies, while they're starting a family. And it's not easy, right? To balance, or I don't even know if I like the word balance, because it's always doesn't feel like it's a balance. But to really find a way to ensure you're both giving enough attention to the startup that you've built, but also your family, right? And both are so important. And it's, I think, something that I've seen successful female founders do is to, one, give themselves grace when things may feel like they're not balanced, because I've heard the term work-life balance is actually probably not the best way to represent it. And two, to build a strong team around them, right? To know that there's a lot that goes into building a company, and teams are really important. And so when like I've had multiple founders recently go on maternity leave, and they've done an excellent job in working with their teams and communicating with their teams, and also just staying in lockstep with them every step along the way. And so I would say it's possible, it's challenging, but with a great team and with also some grace, realizing that no one can do it all at any given time, but you can have it all at different times, right?
Right, for
So
sure.
that's
Yeah,
something.
I learned that pretty quickly in my experience. And I shifted from sort of that thought of work-life balance to kind of just sustainability, right? Just keeping it all all together. I was never a big fan of the term lean in either, because I don't know, I think, I've always been leaning in, so I didn't
Right.
love that as a movement, but I do think, managing that balance and keeping an eye towards sustainability, and that some, at different times things give. But I think that also, in seeing a lot of the menopause and even later, post, sort of the maternal stage and post children entrepreneurs come into the space, that has something to do with it too, right? So not only is there the lived experience, but at the same time, it's like, would we ever look at a man who's 55 and an entrepreneur or coming, as sort of past, but with women, the perception, the lenses are a little bit different. But I'm excited and energized to see more and more women coming into that entrepreneurship role and innovator role in in that point of their life where, maybe they don't have young children anymore and therefore they do have more time
Yep.
to emphasize on it. So, but also the renewed energy around women's health and menopause and all of that. So there are some opportunities there. And that being said, around the sort of current environment, I'd love to hear your thoughts. I mean, obviously, we talked a lot about that with Neil Carpenter and the group that we had at Health Impact. But digital health has had its peaks and its valleys. The whole sort of investor environment right now is a bit of a valley. What are you seeing in terms of that environment and how that's changing or changed in the last couple of years?
Well, there's definitely been a change from 2020, 2021. And we're seeing a market that has adjusted. And we're seeing less VC funding than we did before, in a higher interest rate environment, in an environment with less liquidity and distributions than you saw before, compared to 2020 and 2021, with a less active IPO market. Although we did just see a few digital health IPOs with Tempest, which is actually one of the companies at NEA, in the digital health space, working in precision medicine for oncology and AI in oncology, and Waystar, for example, just IPOing. So we're starting to see some signs of pickup. The first half of 2024 of digital health VC investment, looking at some of the Rock Health data, looked like it was picking up compared to the same time in 2023. So we're seeing some signs of pickup, but still, by and large, it is not the same market as it was before in 2020 and 2021. It's harder to raise financing rounds, especially for later stage companies, and even Series A's are getting tougher to raise than before. The rounds are smaller, typically, and there are more bridge financing rounds, unnamed financing rounds as well that you're seeing. The other thing that I mentioned is, despite the tight funding environment, overall, AI-based companies, especially generative AI, has still been a very hot area. And I would say, both in terms of dollars raised and valuation, have garnered higher amounts of dollars raised and higher valuations, even if revenue traction is not yet at the same place as a non-AI company, right? And so that is another trend that I'm seeing. And I believe in the power of AI overall in healthcare, and have been looking at some of these companies, but trend that I've looked at is definitely the dollars raised and valuations have been a bit higher in that category, that I'm seeing now.
For sure. And I mean, in terms of how you're looking at companies, I mean, other than are they using AI or not? Are they a AI native, company or sort of, more maybe patching it on there to make them sound like an AI company. But in terms of, how you're evaluating, I mean, we talk a lot about, digital health value and measuring that and where do these companies really move the needle and impact, right? Do you feel as though the criteria that you as an investor are using, has changed since 2020 to now, or is it more just that there's just less money to go around,
What's really important to me is, given our focus on health equity and our lens towards that, looking at both financial metrics, but also, is this ultimately making a good impact on patients? is this something that benefits both patients and whatever business organization the company is selling to? Because as we know, most of healthcare is not necessarily funded by the consumer themselves. And so in terms of metrics that I've looked at and have always looked at, are things like engagement. How are patients actually engaging? Are they using the platform? What are the outcomes that come out from that in terms of clinical outcomes? If it's a diabetes company, things like A1C metrics, and how are cost outcomes in terms of total cost of care, MLR. The other area is reducing hospitalizations and ER visits, right? Especially for higher acuity patients and chronic conditions as well. And so engagement, clinical outcomes, and the third area is around financials. And it's around things like not only revenue growth, but gross margins, unit economics, looking at a per patient basis. What does the LTV CAC look like? What does the customer cohort data look like? And even though most companies I look at today, given we're seed and Series A stage focused, are not yet profitable, do we feel like there is a path to profitability? And how are they at managing their cash and cash efficiency? What does the burn rate look like on a monthly basis? So those metrics for me have not changed since 2020, 2021. But I think in the market, there has been an increased emphasis on an earlier path to profitability and more focus on some of those cash efficiency metrics, given the tight funding environment, right? Because now folks are guiding towards raising capital for at least 18 to 24 months, right? To make sure you have enough capital to reach the metrics for that next fundraising round, and knowing that it may take more time to raise that next round of financing as well. And so if anything, I think it's similar metrics for me, but because of the tight funding environment, it's even more of an emphasis in the market on things like cash efficiency, cash management, and managing growth and profitability, which can be tough, right? Because in the 2020-21 market, it was definitely a little bit of more growth at all costs, or just keep on, like, funding is good, so you can always raise more money and keep on growing, and as long as you keep on growing, you can raise more funding. In today's environment, you've got to grow and you've got to be cash efficient, and that's not an easy task. So that is a piece that I think has changed from the 2020, 2021 environment.
Yeah, for sure. And especially with, like, in that there's so many they're mission-driven companies. A lot of people get into sort of healthcare entrepreneurship around a passion project, and whether it's problems you face in the healthcare system, or those who come to it with a bit more of a broader base understanding of the stakeholders and the problems, but still often a passion project, and profitability isn't always the first. Cash efficiency, it's not the first priority, but it should be. So I think that's really, really solid and sound advice. In terms of, I think that you could discern what, sort of that piece of advice from what you just said. But when you are talking to your companies now, or companies that come to you and you say, well, you're not ready yet. What's the one piece of, sort of wisdom, advice, or what do you hear yourself saying most often to them, to get them ready, to get them to that next level?
Besides that, cash is the lifeblood of the company, which I think managing that cash well and understanding what the run rate is. The other piece I would say is really having a strong sense of customer need and listening to your customers, especially in the earliest stages. It's so important to ensure that you are building a company that is actually solving a need rather than adding another point solution to the market, right? And to do this, you literally need to talk to hundreds of people, and include the patient in that, right? Even if the patient isn't paying,
how does this improve patient experience, and will they actually engage with it? Is this something that will take away waste, or could it actually add to the complex healthcare system? And so I would also encourage them to talk to as many customers as possible, even after their post-product, post-revenue, right? Constantly be listening to customers, constantly be iterating, to try to improve the patient experience, the experience for payers or providers or pharma or whoever they're selling into, because that is ultimately what helps companies succeed. And especially in early stages, there is probably going to be more pivoting and iteration than in later stages.
That's great advice, and I think the patient-centered, sort of focus on it, but with profitability on the mind, right? In terms of how you innovate and what that sort of path to success is right now. I mean, I always think if you don't, because sometimes you'll meet innovators and it's like, well, we're just dealing, our customers, the provider market, we're going after the hospital. We're direct to consumer, we're going after the patient, we're really, it's an insured model. We're going after the insurance companies. And I think I generally think, well, if you don't serve at least two of the three, and probably one of them has to be the patient, you're not going to move forward, so really, really good advice. So, I could talk to you all day about this. I love talking about it and learning about it myself. I feel like I should know more, based on how many innovators I've seen and talked to over the years, but it is, it's always changing. So it's good to get a fresh perspective. So thanks so much for joining us, Emily. Tell our audience how to reach you at Zeal.
You can reach me on LinkedIn. Feel free to reach out and send me a message, and would be happy to chat, whether you're innovating in healthcare, whether you're another investor, or just working in the space and believe that we could have something to collaborate on. Would love to hear from you.
Awesome. Well, thanks again, Emily. Thanks so much for sharing, the information and what you're doing in terms of inclusive investing there at Zeal. It's so important that that is embedded and part of our, bringing innovation to the healthcare ecosystem. I hope our listeners enjoyed hearing from Emily and her unique perspective and the valuable insights into the future of digital health investment. I look forward to seeing her work and hearing from the rest of you. As we look to create a more diverse innovation landscape in digital health. Thank you for listening and keep innovating for impact. This is Megan Antonelli. Thanks everyone for joining.